Okay, so we're taping for swelling and for bruising. Obviously you can see total knee, lots of swelling and bruising. So the type of taping I'm going to be doing is for lymphedema. It's like a lymphedema technique or a swelling technique. I'm going to show you how I measure the tape and then show you how to cut it. So when I measure for swelling, when I measure for taping for swelling, what I'm going to do is try to start somewhere above it, as far up as I can, and then I'm going to go all the way down to below it. Okay, so I will cut the tape. I want to try to come down towards the ankle if I can, all the way down to there. So when I cut it, it's going to be this long, and then I'll show you how we're going to cut the slits. And what I'm going to do is I'm going to put one piece on either side of her knee. So when you cut the tape, you always want to round the corners. That keeps it from peeling up as quickly. And I usually cut, as long as you have really sharp scissors, you can cut the tape a couple pieces at a time. So I'm just rounding both corners at the same time. Now when I go in to actually cut the tape into slits, I'm going to cut one piece at a time. So what you do, depending on the length of the tape, I'm going to double it up. And because it's so long, I don't want really long strips because those tend to come up in between. So what I'm going to do is I'm going to take it here. I've doubled it up. I'm going to double it up again to this line so that this part is not going to have the skinny strips in it. It's going to have wider strips. But this is all going to have skinny strips. When you're cutting it, you have to have sharp scissors, otherwise you're not going to be able to cut through that many layers of tape at the same time. Okay, and then you just want to hold it firmly in your fingers, and you may have to adjust it as you go to hold really tight, and you're cutting up to that line. Sometimes it matches up where you'll be cutting actually on the little dash lines that it has. Sometimes it won't. Don't worry about that. It doesn't have to be perfectly spaced. You just want it to be, you know, narrow. Okay, so now when I unfold this, what I've done is I've cut two sections at the same time. Okay, but this middle part is solid, and I don't want to leave that solid because that can actually cause an issue with the skin right in that area. So I'll fold that back over, and now I've got this area where I haven't cut in before, and the other cuts stopped at this line, and I'm just going to make two slits here. So these strips in the middle right here are wide. So we've got narrow strips, a couple of thick ones, and then narrow strips, and then the end. Okay? To prepare her leg, if it wasn't already wiped down, I would wipe it down with a wet cloth to make sure that we got all the skin oils off. Okay? If it's already been wiped down, or if you know it's clean, then what I'm going to do is put on a skin barrier wipe. Because she still has a post-op dressing on here, I am not going to spray her with a pre-tape spray. I'm just going to wipe it with a skin barrier wipe around it. That's just a personal preference. The skin barrier wipes, it's just something that helps it to stick a little bit better, but it also protects the skin. It gives it an easier way to release. Now she's already been taped once since surgery, and if you look at this area right here, you can see where the striping has already occurred, where it started to release that swelling and that bruising already. But this other bruising appeared after the tape, like in between the tapings, and we've been letting her skin rest. And then you're going to let that dry for just a second before you start applying the tape. You want to make sure that it's not still feeling wet whenever you start to apply the tape. Okay, so her skin is dry. It doesn't still feel tacky or anything whenever I'm touching it. So when you go to apply this tape, what you're trying to do is cover, the reason you make splits is so that you can cover the most surface area possible, okay, without putting a bunch of extra pieces of tape on it. So when you go to lay it down, you want to break the tape, okay, right above where all the slits are, so that you can pull the slits off all at once, pull that off all at once. And then this, and I always fold it over so that I can get a hold of it easier. All right, so I'm going to fold that over, and then I'm going to lay this down just past where the bruising starts, kind of angling towards this to where I know that I can get the most coverage, but I don't want to go over her post-surgical dressing. I want to try to stay away from that. So I'm going to put this down, and then I can angle things once I start laying it down. So I pulled off the very tail end, and that's the first part I lay down. Rub it just a little bit. The glue is heat activated. You always have to rub just a little bit. You don't have to rub hard, rub fast. And I'm going to peel this up to the next, to where the thick cuts start, okay? And then I'm going to hold it like this. Now, this is no tension. You can see it's just laying. This is like full tension. I don't want full tension. I actually want very, very little tension on the tape whenever I put it down. I'm not trying to overwhelm the system. I want to assist the lymphatic system. So you're going to pull it up just a little bit and then separate one little piece at a time, and you can kind of angle it down and just press it down. Okay, so again, I'm trying not to put a whole lot of tension on the tape, just enough to keep it from laying down before I want it to. And then a lot of times I'll come to the other side and I'll put that piece down, so I kind of know what my spacing is going to look like and how far I can move stuff around. So once I've got all of those down up to the big chunk, then I'm just going to rub it lightly and rub it fast just to start the heat activation. Then I'll give it a good rub after we get done, once I get all of it down. And then I'm going to pull off to, somewhere into the next section, just so I can lay down the wide strips. And again, this is where I get to turn it if I want to angle it up a little bit more towards the anteromedial part of it, but not getting too medial. Then this is where I can angle it. I'm going to lay that down, rub it just a little bit, and then I'm going to pull off all the way to the last stop. Okay, so now I've got all of these separated again. Okay, and I'm going to separate these to spread them out as much as I can to cover the most area. Again, I don't want a ton of tension on the tape. You're just putting enough tension so that you can separate it, but not really so that you're pulling hard on it. You shouldn't see the edges of the tape like start to split or anything. Okay, once I've got them kind of where I want them to go, then I'm just going to smooth them out, and then I'm going to put the last part down. And then I'm going to give the whole thing a rub to warm up the glue. And this is going to help both with the swelling and the sensitivity caused by that excessive swelling. And what you should see whenever you take it off, because it can stay on for 3 to 5 days, it can get wet, okay? Leave it, just pat it dry whenever you get out of the shower, just pat it dry. But what you should see is actual striping that appears where this has lifted that bruising away. And I could put tape here and up to here. I'd probably have to have her lay on her side so I could get it. I'm going to put it on the other side so that you can see how it looks on the other side too. And I'll show you kind of the finished product of that. So we'll be back in just a minute. Okay, so for the other side, I had her roll just a little bit, really more for the camera than to actually have to put the tape on. So I've already broken this just like I did the other one. I'm going to lay this down. Warm it up just a little bit. I'm going to bring this in. Try to get as much coverage as I can. Again, very, very little tension on the tape. So here's the other side with the finished taping. And again, I could have her roll and I could put more tape on the back side. I could even overlap this with extra tape going in different angles to create more lift. I don't want to overwhelm the system. And sometimes the tape does not stick well to itself. It sticks well to the skin, but not to itself. So I found that minimal is better. So usually a strip up one side, a strip up the other side is enough to make a difference, to pull that swelling away and decrease the bruising and move that fluid along in a quicker fashion than if we just let nature take its course.